Yeah.
Just interrupting the whole thing.
Yes.
Please.
Determinants of the health is basically divided into concepts of the health: wellness, disease, illness behavior, sickness, impairment, disability, handicap. So you need to know each level of the health determinants. What happens is in wellness is basically state of the dynamic, physical, mental, social, spiritual. So a disease is happened when there is a physical, mental, social, spiritual, all of the four factors are disturbed. Then you are going to talk about there is something wrong with this patient. Even any of the single factor is disturbed, it means the patient is in disturbed state. So talking about the wellness, if these four factors are okay, and in well-being that enables a person to achieve full potential and have an enjoyable life. Coming to the disease, what happened in the disease is basically abnormal medical defined. Any of this, where the structure and the function both are disturbed or any one of the disturbed. So coming to the structure and the function, you need to, you know how this is works. Now coming to the illness. Illness is basically a patient. Now you need to know the difference between disease and illness. People actually think disease and illness is same, but disease and illness are little different. The definition is different. Individual experience or subjective perception of lack of physical or mental well-being and consecutive inability to function normally in the social roles. So if somebody is walking properly, he's unable to walk, or he's thinking that he's unable to walk. So this comes in illness. The illness behavior is basically the actions resulting from and responding to the illness. So if somebody is fever and feeling like a fever, those two are different things. Coming to sickness, view the individual and the society hold towards a health condition affecting their thoughts and then actions. Impairment, what happens in the impairment? A loss and a abnormality of the psychological. So these words are very, very important: psychological, physiological, or anatomical structure. So these three should be there to make it the impairment. Now they said physiological or in anatomical or functional. So these are the or ones. So this could be physiological, this could be anatomical, or this could be a functional. So even somebody is born with something, this is basically impairment. And something happened after that, like some accident and amputation happened, then also it's an impairment. Coming to disability, a restriction or the lack of ability to perform an activity. So these definitions are given, and then you need to know the what is actually being fall in which category. Coming to handicap, limits to the access of the fulfillments of the patient's role, and then age, sex, and social and then cultural factors. So these concepts of health will fall in the palliative care. So on the basis of the which criteria the person is, what kind of treatment he needs. This is what the medical officer or the person who is working as a family physician or whoever the liable for that patient is going to determine and provide the resources according to that. And those resources are going to be divided on the basis of justice and on the basis of the equality and equity. So then we are going to see if the patient has needed this one or this one or this one. So that's where the concepts of the health work. Determinants of the health is basically income and the social status, employment, education, childhood experience, physical environment, social sports, health behavior, assess of the health provinces, biology, genetic, gender, culture, exposure of the colonization and racism. So you need to know the determinants of the health on your fingertips. So remember all these determinants of health on your fingertips. Now coming to the equality and equity. So what are you going to see on the basis of the equity and equality? If the patient needs the thing or the patient is more needed of this thing than the other person. Equality is every person need this. Now coming to the equity, when all the people have the opportunity to attain their full health potential, whoever has whatsoever the disease is, somebody in the cancer is on the first stage, somebody on the cancer on the fourth stage, both has the full equity to enjoy all the resources what they can provide or given to the person. So disadvantage from the achieving, what happened in the disadvantage. So disadvantage is important. This can be tested what happened in this disadvantage. If a person is in the fifth stage of the cancer, if the person in the first stage of the cancer, same resources are given to both of them, what happened is many of the resources can be used in a way. In the fifth stage of the cancer, in the fourth stage of the cancer, the person is eventually going to die. So if you give them the same resources, it cannot be used for the other person. So that's why this is equity is kind of giving some disadvantages for achieving the potential what we need to, because this equity, the resources we use is eventually want to save the patient. But if you cannot save the patient by giving it to the first, so it means you are wasting those resources. Coming to the equality, defined as the population have equal or similar health status. Health equality inequalities are systemic differences and do not necessarily carry other moral judgment. So equality is basically every person is equal. Fifth, first, those people should be taken off all of those things. But equity, you need to find out which one is the first person, which one needs it, and given to that resources first, and then the other person can be given. Like how we activate the codes, like first code, like yellow code, red code, blue code, those codes. So the base of that, we are going to see this patient needs tertiary healthcare, this patient needs fourth, the secondary healthcare. So on the base of that, in the equity, this is how we divide the equity. In emergency, if you go, which person needs the first and which person needs the second. Coming to the determinants of health, all you need to remember this table: population health model, what comes age, sex, and hereditary, then environmental lifestyle, social community workers, housing, health and services, water and sanitation, unemployment, education. So just go with the name, equality and equity, don't mix anything else. Then work environment, education, and agriculture. So general. So firstly, starting from the below, what happened is age, sex, and hereditary. Obviously, you cannot change these things. Then moving on to the next one, lifestyle factors, which you can change. Here, the prevention starts. Then talking about the social and environmental factors. Here, the stress level starts. So you can change this one, causing the psychological issues. Then comes the housing, healthcare. So this is coming to financial problems. So in this respect, what you can do is talking about financial and correcting the financial issues. Now coming to the genetic, this sorry, general social cultural. So this is basically when somebody is unable to accept the thing and environmental condition and try to cultural. So some people are so extremist, they doesn't want to, but if in somewhere like somebody is vegetarian, those people, they don't go with the thing. So you are going to do is adding the supplementation for them. Definition of the health, according to who, what happened is that in the definition of the health, state of the complete physical, mental, social, and not merely the absence of the disease or infirmity. So if the person doesn't have the disease or doesn't have any illness, still not able to properly work because of the mental issues, because of the social, like not finances and those kind of things, because of the physical issues, this is coming as a health compromisation. Okay, according to who. So who updated the definition now again? The ability to identify and to realize the aspiration to satisfy the needs and to change or cope with the environment. Health is therefore a resource of the everyday life. So this is basically everyday life, not the objective of living. Health is a positive concept emphasizing social and personal resources as well as the physical capacities. So what you need to remember here is, if the definition is here, so you need to know this is given by the WHO, and along with that, this is Ottawa's Charter for the Health Promotion. Along with the WHO, this is basically also the Ottawa's Charter. Other definition of the health has since been proposed and then incorporated after the dimension. What happened in this one, social, economic, and political. So now they change the word social, economic, and political, all the fundamental rules. So patients, this is basically a people's charter of the health. So health is basically now that this is the end definition, which is given by the National Aboriginal Health Organization. What is the definition? Health is continuous, harmonious interaction and balance between the physical, emotional, spiritual, mental, intellectual realism. Coming here, cultural, humility, safety, awareness, sensitivity, as we already discussed about these ones, you just need to know the basic one. Now coming to this one, Ottawa's Charter for the health promotion. One of the very important thing, usually it's basically Ottawa's Charter, but still they try to attest if you even know about anything, because not many provinces are given here. So this is what it is given here. Now, what is Ottawa's Charter? Health promotion. So the process of enabling the patient to increase the control over and improve the health. So this is basically Ottawa's Charter. This is health promotion of the Ottawa's Charter. Some health promotions can be achieved through the clinical interaction with the patients. So they try to ask you, if the patient is having this kind of diseases, how you can modify it, how you can make the disease less, how as a family doctor or as the doctor in the province or as the doctor of the rural area, what you can do to make it better. So those kind of things will be like, making the resources better, making the staff better, making the education better. So those things will work according to the need of that rural area, what you are going to do for the health promotion and preventing that disease. Let's suppose if you are working in a rural area and you in your area there's a lot of MI patient. So what are you going to do as a patient, as a doctor, to prevent it further, or to make it better from the other provinces? That's what your duty is: providing the resources, providing the, like, let's suppose, providing the ambulance, providing the nurse education, providing a lot of resources, providing a lot of hours to people can come and talk to you and has better education. So coming to this one, then they can even ask you if the patient is sorry, if you are working in a municipal area, if you are working in a rural area and there is a lot of these patients of the diabetes, how you can prevent privilege the awareness of the disease. So this is also up to you how you're going to talk about. This is basically providing the education through pamphlets, providing the education through TV, providing the education through whatever the thing is. And then they can even ask you how you're going to privilege the disease in the uneducated people, then in educated people, in this kind of population, in that kind of population. So you need to know, this is all about this thing here. So clinical interaction with the patients and most relevant promotion is done to the population by the public health professional and agencies through engaging, formulating policies. So formulating policies, you can ask the patient to come in the this day, that day, follow up, those kind of things. Then influencing the upstream factors. So whatever is getting better, with what resources you can increase the resources. Ottawa's charter is a framework through the population. So the answers are not directly written, but the words will give you the hint of choosing the answers, what you can do as a doctor, or what you can do to health promotion, specifically what in the particular populations. State that the healthcare provides will be provided, then building the health and creative, sportive, strengthening community actions, providing the personal skills and reorienting the health services. So these are the things that as a health doctor you can do to increase the health promotion. Now this one here, so each population, what kind of diseases can present, and what kind of diseases, if they present, what you need to do in the first step in the screening. Let's suppose a 25-year-old indigenous female can present to you and ask for the regular normal checkup. So in indigenous, there is certain type of diseases that can be there, even she is coming totally normal. So you need to know what kind of screening you need to do, like depression, talking about PTSD, talking about TB, talking about anemia, talking about any abuse. So these are the things you are not going to forget about in the indigenous patient. But at the same time, if the female or the male is from the Asian community, talking about lipid profile, talking about the lipid profile, talking about the diabetes mellitus, these things are heart conditions. These things will come first, then talking about the different things. So if they are coming normally, normal checkup, so this is what we do according to the population. There is certain diseases that run and their screening is important according to their population. So population prevention specific diseases. So if their population, the disease is already been tested, screening is done. So if they are going home, now as a family physician, what are you going to advise? So talking about those ones is basically mental health awareness, diabetes mellitus, providing the specific diet, if they need any resources, providing the financial aid, connecting to the community resources programs. So those are the things as a normal, as a person, as a family physician, you are going to refer or give to the indigenous population. Along the Black population, you need to know what kind of the disease, like diabetes, like BMI, like hypertension. So they have written here high BMI, high hypertension and BMI. So it is very common in Canada. So you have to be, as a physical doctor, starting from the general history, physical examination, and then certain diseases you are going to do a screening. So then it comes to the, what are you going to do, culturally specific, then anti-racism. So a lot of people, Black people, go through the racism. So make sure to rule out about their psychological issue as well. If there are depression, there are PTSD, or those kind of things are going on. So make sure you evaluate the psychological aspect as well. Then police violence through the transparency, and then public outside. So if they need any community resources programs, social workers, connect with them as well. Coming to the isolated seniors, a lot of people go through the abuse, adult abuse. So they are going to be like, then you are going to talk about the fall prevention. So these are the things you are going to fall, urine, sight. This is the thing you are going to check in the every senior: fall, urination, sight, like vision, hearing, and their balance. So these are the things you check in the mobility issues, if there is anything like that, then these are the things. And along with that, polypharmacy. So what are you going to do? If there is no social support, you can connect them with the old age houses so they can take care of it. And then in the fall, you can prevent from the injury. How you can do that? Providing them the aid, walking aid, providing them the some person who can take care of them. There is a lot of programs, senior houses, so those can, and nurses that can take care of them. Coming to the individuals and the children.
Dr.
So if
Kainat,
just give me a second, let me complete this one, then I will come to you. So coming to the children and poverty. So if some children is coming to you, especially the adult who is stepping in the life of where she is going to start from the sexual life, the first thing first, you are going to talk about oral contraceptives, and then giving the education about the sex. Has she needs to use the condoms and those kind of things. So eventually she needs to come with that one. Improvement in the income, because they are in poverty, so you need to talk about this one. Assess the health education, so these one. Coming to the disabilities, they have written here. New immigrants, what you are going to talk about. So new immigrants is very common in Canada, so a lot of diseases, a lot of problems is happening with new immigrants. They face a lot of racism, so how you are going to assess them and what kind of financial aid and resources you can provide to them. Because a new immigrant doesn't go to any person but goes to the family physician, so you as a family physician has to connect to the social sports and community programs as well, so they can provide the financial aid and all of those resources what he needs at that time. Then no fixed address, the person is basically homeless. A person no fixed address may be homeless or living into the one motel to different motels, so maybe having food problems, mental illness. So these kind of things you are going to address. So make sure whoever is coming to you who is young, don't forget about the psychological problems. Refugees, religious minorities like Muslims and Sikh people, what kind of racism they follow, what kind of things you need to rule out. So those kind of things. Then coming to LGBTQ, a lot of people suffering from this disease. So, you need to be very sensitive about this one. No, don't assume their gender, talk to them nicely, and then you can see this. Just give me a little time so I can just cover these things. So you can read this one, and then let's just directly jump to the one which is needed. Talking about the prevention, you need to know the premodal, primary, secondary, tertiary prevention, 4 type of prevention. Even there is a quaternary one, but it's not written in Toronto. If possible, go to Google and find out especially the causes of the thing. And along with that, especially the examples. With examples, it would be very, very easy. Then coming to the types of surveillance. So you need to know the passive and active surveillance. So you can read all of this from here. I'm not going to go very detailed with this. So passive prevention, you can read all of this one. Primary prevention with their examples. The examples are more important than the definition. I'm giving you the examples more important than the prevention. So they have given primordial, primary, secondary, and tertiary. Actually, quaternary is there, and I think it's written in up to date, so you can read it from there. Coming to the screening is also part of the thing. So we know about the screening, so you can read this one. Types of screening: universal, selective, multiphasic. Coming to the bias. So there is only 2 bias written here: lead time and length time. So you just need to know this much. I mean, in UWord, there is a lot more biases written over there. I mean, you have time, you can read them, but these 2 will be more than enough. Coming to the ideal criteria: disease, test, and healthcare. What happened? You are going to identify the disease, test, you are going to do the test to check out the disease, and then healthcare system implementation of those things. Then disease prevention and disease promotion. Make sure you know the difference. This is very, very important. You need to know how you're going to approach the prevention and how you're going to approach the promotion. Public health policy, what are you going to implement? The basically official, legislative, social. So make sure whatever you're reading here, each and every word is making sense to you. If it's not making sense, there is no point of reading it. Very comprised words are written here, so whatever line you read, you need to know actually what you are reading. Otherwise you won't be able to solve public health questions. Then coming to the behavior change, health belief model, these things. So this is one: pre-contemplation, contemplation. If somebody has read already family medicine, they know better about this. I am just going to directly jump to occupational health, one of the most important topic of the public health. And I want to touch, so you can remember all these definitions and everything. So let's just directly go there. So where it is, just give me these all are the definitions. You can read all the definitions and examples and the system. Just okay, if you are going to talk about the population occupational health, what you need to remember: a person who's coming for the first time, What are you going to counsel as a family physician? If the person got exposed, what are you going to do as a family physician? And the third, if the person is coming to you, has been already exposed, has been already treated, and now going home, what are you going to do about that? And at the same time, if the person's employer, like from the factory or wherever he's working, asking you about the information, what are you going to do? Obviously taking asking about their consent and those things. So this one is written here, what you can do about that. And along with that, if the person got exposed with the disease, what are you going to do? Always report it to the occupational health minister. So they are going to do further what they can do for this person. Along with that, you have to do the basic chest x-ray if you got exposed with something which is basically inhaling. So you are going to report that one, doing chest x-ray. And there was a previous chest x-ray. What are you going to do? Like somebody is coming for the first time and want to start a job as a first he's going to start the job. So what are you going to do at the first point or at this point as a medical record? So doing a x-ray for the further thing. So these are the things you need to know in occupational health. First, got exposed, after exposure, going home, if he wants to increase the hours while working, what are the things you are going to do? So especially everything I think written here, public health history. So what are the things, chemical, occupational, and this one happens. So everything, personally, everything written here. So if you still want to read, you can read AFMC primer. Everything's written over there as well. So primary prevention, this is what I talked to you. If somebody's coming for the first time and asking you, let's suppose you did all the tests. Now somebody's coming and asking you, what should I take care when I was doing that job? And secondary prevention, if you had already been exposed, now if he's going home, what are the things you are going to do? Okay. Tertiary, if somebody is basically having the treatment of the disease, now something has already been happened while he was working, now what he needs to go to be done when going home, like especially the hearing aids. Most of the people who are working in a noisy population has problem with the hearing. So these kind of things. Now, if anybody has any question from this one here, I particularly give you a rough idea where you can do from this one. So public health for the good Q bank is basically, they said Canada Q bank, you can do it from there. But if you still want to do from somewhere else, I mean, you can do it from UWord. That is also one of the good way. What did I say? Causes of what? Did I say anything about that? So you have to remember all of this occupational health hazards. So remember all of these ones, and these things in the middle, this facial racism and these ones, all you need to know is basically in the food, because we are going to talk about food. Food is basically outbreak happened in old age houses, in daycares, in old age houses, daycare, community resources program, where the people are collective together, living together, especially in the hostel areas. If somebody like females are living together, for the refugee, when they take the people to live in together. So those kind of food break resources that happened over there, especially the people who are coming from outside and refugees. Those people, when they live together, most of the thing happened. And if those outbreak happened, who are you going to report it to? Because all of the things are not reported to public health. Every reportation has its own program where you are going to report it. So what happened is, like, suppose if there's somebody is unable or unfit to drive, you report it to the transportation health. If the person is having something with the diseases, then you go report it to that particular person. So for the food, and especially for the refugee person, there is different departments. So look into that one and find out which are those ones and who are you going to report it. So each and every disease has its own department where you are going to report, especially the educational health. Polypharmacy in the elder abuse. Polypharmacy is not an elder abuse. Why would it
Yes,
be an
it's
elder abuse?
totally different.
Yes.
It's more with
Polypharmacy is not an elder abuse.
frailty and genetic syndrome and admissions, and yeah.
So
I think
polypharmacy mostly happen because of the mental illness of the person. He is unable to do it. So what you are going to do is coming to you polypharmacy. So you need to know, start stopping all of those medications, which is unnecessary, and asking the patient to come for the follow-up. And if the same person in the geriatric having delirium, so make sure you rule out delirium in that person. So what they are looking for, I might think that delirium is what they are looking for here, or dementia. Anybody else who has any question about this one? That's about public health. And about the formulas, I would say, I mean, it's okay to sometimes what happens, you even know the formulas and unable to get the answer. And I mean, it is something that I can't say anything about that. You have to be very quick and about that. So what I can give you a trick about this one, just red flag it, go and solve every question, come back and solve these questions. Because if you and eventually ended up stuck with this one, you will waste a lot of time and you will not be able to solve all the exam. So do 2 by 2 table. Yes, 2 by 2 table come in exam. That is another thing. 2 by 2 table is an important thing for refugee, where to report. So if the disease is from the food, you are going to report to the food health inspector. If the food is sorry, the disease in the refugee is from the lungs, like TB, then you are going to report to the infectious disease inspector. Those are the diseases. According to the disease, we report it. It's not like refugee has a different department. No, according to the disease, we see what, where or who I can report it to. And if the disease outbreak, what are you going to do about that one? Like putting that one person
one is private charge for $15 per class.
So if somebody is having a disease or having a problem, so what are you going to do to prevent the outbreak to happen in the whole community? Let's suppose in a refugee, if a disease happened in one person and it might be suspicious of, like, let's suppose one happened TB. Let's suppose have somebody happen Clostridium difficile that can be spread to the different population. So what at that time you are going to do with that person is also important. Is program. Actually, you need to go and look into the .ca. It says CIBC.ca, something like that. And every disease particularly is written over there. Who are you going to report it to? So especially the disease of the food, they are going to be reported to the food